So overactive bladder is one of the most common conditions that we treat at our facility. Women with overactive bladder can suffer from frequent trips to the restroom during the day or up multiple times through the night. They can have this overwhelming urge to urinate, which often leads to urine leakage. Now, to understand why these symptoms occur, we must understand how the normal bladder functions. And as the normal bladder reaches its capacity, it sends a signal to the brain, telling the brain that it's full. And the brain sends a signal back to the bladder, giving the bladder just a little mild squeeze. And this is the sensation that the normal person feels when they need to go empty their bladder. As the bladder continues to fill, these signals intensify, prompting you to find a restroom. Once seated and ready to empty, the brain sends a strong signal to the bladder, causing the bladder to contract and empty, almost like squeezing a balloon. Now, with overactive bladder, as the bladder itself begins to fill, before it reaches its capacity, it's already sending signals to the brain, telling the brain that it's full. The brain, sensing that the bladder is overfilling, begins sending signals back to the bladder to empty. Now, these abnormal signals continue to intensify, resulting in a miscommunication between the bladder and the brain. And it's this miscommunication or overactivity of nerve impulses that lead to the symptoms associated with overactive bladder. Now, the good news. We've had tremendous success at treating this condition beyond medications. Thanks to InterStim therapy, women no longer have to suffer from the life-altering symptoms of overactive bladder.